Good evening and welcome to all of you. Uh, Welcome back to this series on professional exams made easy, where we discuss about the most frequently asked questions from different sections of anatomy. Till now, we have discussed about the gross anatomy topics. We have discussed about the embryology topics, and last week we had discussed about the important questions which can come from systemic uh, general histology. And today we will focus on what are the topics that can come from systemic histology, and we'll also try to discuss a couple of important questions. Okay, so with this, let's get started with today's session. Usually, systemic histology in majority of the universities is asked in paper 2. So please check with your blueprint once again to confirm which paper this systemic histology is often asked. And again, systemic histology, the weightage is anywhere between 5 to 10. On an average, let's say 8. Usually you get a short essay, a 5 marker, and maybe a 3 marker, or like a 5 marker and few MCQs, right? So the weightage for systemic histology is between 5 to 10, I would say, right? So what are the frequently asked topics? So let's try to learn it system-wise. Now, from the topic of GIT, right? I will skip the order here because let's go straight to the most frequently asked topics in GIT or digestive system, right? So the most frequently asked question in the digestive system is either liver or the pancreas, right? Describe the microscopic structure of liver. Describe the microscopic structure of pancreas. Usually, this is the question that you will get, right? Uh, hi, hi Venkat. Good evening. So, liver and pancreas are the two topics that I would prepare every time if there is an anatomy exam. Okay, so these are the two topics that you must never skip. And we will focus on how to describe the histology of liver or pancreas if asked, right? Now, apart from liver and pancreas, the other questions will be on the tongue. And in the tongue, they will specifically ask about the microscopic structure of the circumvallate papilla, right? Or the fungiform and filiform papilla, right? Even in your systemic histology slide discussion, okay? So these are the two slides from the tongue which can often come. So one is exclusively on the circumvallate papilla and the other one is on the fungiform and filiform papilla, right? Then the next important question is on the histology of the stomach, right? Esophagus, yes, but the chances of questions coming from stomach are comparatively more, right? So in stomach, the fundus of the stomach and pylorus of the stomach. Remember, for any part of the GIT, except let's say the tongue, if question is asked starting from esophagus till the large intestine, right? You need to follow the common template, right? One is start with describing the mucosa. In mucosa, we often look for one is the lining epithelium. Then the next thing is the lamina propria. And the next thing is the muscularis mucosa. So when you describe the mucosa, you must describe it in this order only, right? From inside out. Then talk about the submucosa, right? Submucosa. Then the third layer, what is it? Muscularis externa. And here talk about the two layers, right? The longitudinal layer and circular layer. And then the last layer, let's say, is the serosa or adventitia, right? This is how we need to describe the structure of any slide or any tissue from GIT. Okay? This is not applicable to liver and pancreas. Remember, liver and pancreas are glands. They are not tubular structures. So remember, this is the template you will follow for the tubular organs of GIT. starting from esophagus till the vermiform appendix and the colon. This is the template that you should follow, right? So the examiner will be very much interested in whether you have mentioned the lining epithelium correctly, whether you have mentioned the mucosal features correct. Okay. In addition to this, specific to each part of the GIT, we need to describe that particular layer in detail. For example, if we are talking about stomach, please go and describe the mucosa in detail. Now, what to describe in mucosa? Remember, you need to talk about the gastric glands, right? So I have marked it separately. This itself is an important 5 marker. What are the different types of gastric glands? Where they are located? How they are structurally different? What are the lining epithelial cells? And what is the function of each of the lining cell? Right? For example, when we talk about the glands present in the fundus, right? We have the short gastric glands, which are lined with the chief cells. Then we have the parietal cells, the neuroendocrine cells, stem cells, mucous neck cells. So we need to describe all of these cells, one line about how they look, one line about their function. So remember, as we have discussed in the last session, histology is all about how the structure looks and what it does. This is the simple template you need to follow for everything, right? Morphology, function, right? So gastric glands is an important 5-marker question, okay? Or even like, let's say 3-marker question where you're asked to draw the diagram of the gastric gland. Then the next important question can come from the duodenum, right? Ileum or jejunum. All of these are again 5 markers, fine? In duodenum, you can always or also get a question on the Brunner's glands, right? So what are Brunner's glands? Where they are located? What is its function? Remember, if it's asked for a 3-marker question, you should be able to write at least 3 to 6 points regarding that structure, right? Then in the frequency, it's not in the order, I know. Duodenum, jejunum, ileum, that's the order. But why I have put ileum is, apart from duodenum, the other frequently asked question from small intestine is ileum. And in ileum, they can always ask about the Peyer's patch, right? What are Peyer's patches? What is its morphology? What is its function? Where they are present? All of this can come, right? So that is one more important 3-marker from the histology of ileum. Then jejunum. But more important than knowing isolated histology of duodenum, jejunum, and ileum, the question can be compare and contrast, right? If you remember, we discussed about this in the last class also. Whenever they need to ask about the histology of cartilage, bone, blood vessel, muscle, right? Where we have different types. They can just ask the question like, compare and contrast the structure of duodenum, jejunum, and ileum. Compare and contrast the structure of the fundus and pylorus of the stomach. This is how question can be framed, right? Compare and contrast the histology of, let's say, duodenum and colon and appendix, right? Very often in the last few years, we see these type of questions in histology, right? Compare and contrast, right? So these are the questions you need to be prepared for. I'll just take a question here. Harini asks, how many identification points should we write for a 5-marker with a diagram? Harini, I would say it is not about the number of points. Draw the diagram first. That is the first thing. So you draw a good diagram, half of the marks is there. Like 2.5 marks out of 5, it's there already. Now, the next description, if you write just the identification points, right, for the discussion, it may not be enough. So we need to go in a systematic order. Okay? Again, when we talk about the liver and pancreas today, I'll briefly describe how to structure your answer after writing the diagram, right? So we will come to that. Then, the other important 5-marker I would say here is the vermiform appendix. Okay? So these are possible 5 markers. And then histology of gallbladder, right? If you are preparing for the systemic histology topics, prepare with these first: liver, gallbladder, and pancreas, because glands of the GIT are very often asked compared to the tubular structure, because the examiner knows that in the tubular structure, you have a template and you will answer easily, right? So to make it difficult, these are the 3 glands which are often picked. And why they usually pick gallbladder is, in the gallbladder, if you remember, there is no submucosal coat, right? The examiner knows this and they want to confuse you purposely, right? So they will ask, describe the structure of gallbladder. And once we start writing mucosa, submucosa, muscularis externa, and serosa, we are gone, right? Because gallbladder has mucosa, submucosal coat, that is, which is the fibromuscular coat, and then the serosa or adventitia. So that is why histology of gallbladder becomes important, right? And remember one thumb rule: wherever you have peritoneum, right, all peritoneal organs will have serosa. So if you're talking about jejunum and ileum, with your eyes closed, you can mention it as the serosa. Duodenum also, it is serosa, except for the proximal 1H, right? Then when we talk about stomach, stomach is it entirely covered by peritoneum, and hence we have serosa. So the simple rule: if the organ is covered by peritoneum, it has serosa. If it is non-peritoneal, it will have the adventitia. So this is the important thing you need to remember. Are we clear? So this is regarding what are the important short essays we need to be prepared for the topic of GI. Are we clear? Right. So this is regarding the topics from GIT. Again, don't forget to read liver, pancreas, and gallbladder. Done? Right. Similar to this, when we talk about urinary system, of course, the most important short essay in this is the structure of kidney, right? Where we need to talk about the capsule first, then the cortex of the kidney, then the medulla of the kidney, right? Some of the exam, we may get questions on compare and contrast the structure of proximal convoluted tubule and the distal convoluted tubule, or compare and contrast the different parts of the nephron. Even this could be a question. But kidney, I would say, is a very important 5 marker. In the topic of kidney, more important than the microscopic structure, I would say, the juxtaglomerular apparatus. This could be an important 3-marker question, okay? Where we need to define what juxtaglomerular apparatus is. Then we need to describe about the components. What are the 3 components of juxtaglomerular apparatus and what are the functions of each of these? Right? Are we clear? So this is how we need to describe the juxtaglomerular apparatus. Define it, describe the components, and then talk about the functions. Are we clear? But this juxtaglomerular apparatus again is an important 5-marker or a 3-marker. So you need to draw a diagram if it's a 3-marker question, right? If it is a 5-marker question, draw the diagram and then try to discuss each of the components under the heading of structure and function. Are we clear? So this is regarding the juxtaglomerular apparatus. Then ureter. Very often we have seen questions on ureter, which is a 3-marker, and more often it is the diagram. Draw a neat label diagram of microscopic structure of ureter. Okay, this is one question. Apart from this, I'll tell you what are the other questions we have got. Compare the microscopic structure of ureter and uterine tube. This we have seen few times, where they have asked you to compare the structure of ureter and uterine tube. The second question I'll tell you, it is between comparison of ureter and vas deferens. Right? The other question I would say vas deferens and uterine tube. So all tubular structure where you get this star-shaped lumen, the examiner wants to check whether you can identify this or not. Even this is very often asked in your histology practical viva, right? The histology practical slide discussion or histology viva, usually this question is often asked. How do you compare or how do you differentiate between ureter, uterine tube and vas deferens? Fine. So this is how the questions can be framed. Are we clear? Right. Then urinary bladder. Again, an important 5-marker. But from the topic of urinary system, kidney histology, juxtaglomerular apparatus, comparison of structure of ureter with other tubular structures like uterine tube or vas deferens. Are we clear? Right. Then in the reproductive system. In the reproductive system, we have seen a lot of questions on the histology of the testis, histology of the ovary, as well as the uterus, right? And then the questions on vas deferens and uterine tube is almost about comparison. Why? Vas deferens is involved in the transport of spermatozoa. The uterine tube is involved mainly in the transport of oocyte. Of course, even spermatozoa traverse the uterine tube, but the structure of the uterine tube is destined to move the oocyte toward the uterus, right? So what is the difference between these two is very often asked. Even in histology slide, we need to be very sure of how to discuss or how to differentiate between these, okay? So once we cover up our theory topics, we will focus on histology sessions, right? How to distinguish between slides, and probably we'll take a session on all the slides once we are done with the theory part. Are we clear? Right. So this is regarding the reproductive system. Then in the respiratory system, the short essay that you may often get is on the anatomy of the lung, the histology of the lung, right? Apart from this, trachea could be an important 3-marker question. There is nothing much to describe in trachea, but lung is a definite 5-marker question. Done? Right. Now, apart from all these major systems, 2 more systems from which we can expect questions is, one is endocrine, the other one is the special senses. In endocrine system, the very often asked short essay is the histology of pituitary gland or hypophysis cerebri. We need to talk about the structure of the anterior pituitary, posterior pituitary. Remember, whenever you talk about anterior pituitary, once you start describing chromophobes and chromophils, for chromophils, you need to list or classify the chromophils, briefly mention how they look, and then mention their function. Again, I'll repeat every histology question. These two are must. How they look, what do they do? This is what you need to write in histology, right? Apart from pituitary gland histology, in the topic of pituitary itself, one question which can be asked, remember, is the question on herring bodies, right? One is question on herring bodies. Then the other question is the hypothalamo, right? Hypothalamo hypophyseal portal system. Okay. Even this can be asked in your systemic histology paper or the general histology or general anatomy question, right? What do you mean by hypothalamo hypophyseal portal system? What is its role in histology of pituitary gland? Okay. This could be a very important question, right? Then, apart from pituitary gland, the other most frequently asked question is the suprarenal gland. Again, we need to talk about the capsule. Beneath the capsule, we have the cortex and the medulla. And in the cortex, okay, so first let's say we have the capsule, right? Then we have the parenchyma of the adrenal gland, which is divided into cortex, right? And medulla. And further, cortex, as we know, is divided into what? Zona glomerulosa, zona fasciculata, zona reticularis, GFR. right? So how does glomerulosa look? How does cells forming the zona glomerulosa look? What do they secrete or what is their function? That's it. Okay. You need not know anything else. Harini, this is what we expect, right? How the zona glomerulosa is formed. For example, this is formed by cords of cells which are arranged as inverted U or horseshoe shape. When we come to zona fasciculata, we have parallel cords. Zona reticularis, anastomotic cords. How the cells look. What do they secrete? That's all. Okay, you need not write all the theory that's given in your histology book. Again, I'll focus on and stress on 2 points. How they look, what do they do? Please remember this. Okay, then describe about medulla. In medulla, what are the cells? What do they secrete? When you write about medulla, please don't forget to add that the medulla is a derivative of the neural crest cell. Now, this is an additional point, right? If you are talking about cortex, don't forget to mention this comes from mesoderm. To be more specific, the intermediate mesoderm. If you can write this, if you can highlight it, this will help you score, right? Then thyroid gland, the question on anatomy of the thyroid is expected, right? The question on histology of the thyroid, not very frequent because two more endocrine glands which are very important and are slightly complicated structure, that is very often asked. If thyroid gland is asked, right? Just take a look whether the question is also asking about describe the microscopic structure of thyroid and parathyroid or thyroid alone. If parathyroid is also asked, ensure that you add the component of parathyroid cells. Otherwise, stick to the thyroid gland histology, draw the thyroid follicles, and then parafollicular cells. Done? Right. Now, apart from this, if we talk about special senses, in special senses, there are two questions that can come. One is the histology of retina, and the other one is histology of the cornea. Right? Now, when you talk about cornea, of course, we all know that retina is made up of 10 layers. By this time, you must have mastered the listing of all the 10 layers. When cornea is asked, again, draw the diagram. Along with the diagram, remember, now when we describe the histology of the cornea, how many layers do we describe? 1, 2, 3, 4, 5, and 6. Right? So what are the layers? A, B. What is A? Anterior epithelium, which is stratified squamous non-keratinized. B is Bowman's membrane or anterior limiting membrane. Then we have C. What is C? We have corneal stroma. Right? Then the layer we have before the Descemet's membrane. Right? So what do we have? We have Descemet's membrane, and then we have the corneal endothelium. So A, B, C, D, E, we know. But what do we need to highlight here is a layer called as Duas layer. So remember, this Duas layer was actually described for the first time by an Indian, Dr. Harminder Dua, right? So make sure you mention about this layer and also highlight it. Okay, so this is how you should describe, right? Again, what is anterior epithelium? Stratified squamous non-keratinized epithelium. What is its function? Protection, prevents the cornea from drying. So this is how you should be able to describe the structure and the function. Are we clear? So in special senses, these are the two questions that I would put my money on. Are we clear? Right. So once we have learned about like what are the important topics that are frequently asked in the special senses or the entire systemic histology, let's talk about two most commonly asked short essays. One is histology of liver and the other one is histology of pancreas. So Harini, now let's take your point for discussion. How many identification points should we write for a 5-marker with a diagram, right? Most of the examiner usually keep 50% of the marks for diagram, right? So 50% of the marks will go for diagram. The other 50% will be for description. So if we write couple of points, it will not be suffice. So you may end up getting 3 or at maximum 3.5. But histology topics, if you are good at diagrams or if you can write a correct diagram, you can actually score at least 4, 4.5. The only requisite I would tell you is always ensure that you draw the histology diagram using a circle, right? So I know that it's not looking like a circle. Forgive me for that oval shape, but draw a proper circle, a smaller one, and fit your diagram inside the circle, right? Most of the students, what they do is they end up drawing a big circle and they find it difficult in completing the entire diagram. So make sure that when you draw the diagram, the circle is appropriate. Okay, it is of a smaller size, and maybe you can leave the upper 1/3 or the upper 2/5 empty. Then write rest of the diagram. Okay, so you will save a lot of time, right? Now, how do we start with description of histology of the liver, right? When we talk about histology of the liver, let's say we always begin with histology is, the liver is the largest gland in the body, right? It is covered by a connective tissue capsule, which is called as the Glissen's capsule. So describe Glissen's capsule in couple of sentences. What is it made up of? What is its function? Then, when you come to the parenchyma of the liver, right? So remember, parenchyma of the liver is made up of the classic liver lobule, right? So describe the structure of the classic liver lobule. So describe its structure, then talk about hepatocytes in brief, right? Then talk about two important spaces. One is space of Dissay, which you will write here. Then once you start describing about the portal triad, in portal triad, name all the three structures and how do you identify these structures. For example, here itself, if we just take this out. So what do we have here? This is the portal triad. In portal triad, we have the hepatic arteriole. Then we have the branch of the portal vein or portal venule and bile ductule. How to differentiate between the three, you must write here. For example, hepatic arteriole will contain the single layered endothelium with a thick tunica media compared to the portal venule. Portal venule will be usually large. It is usually the largest structure and it is thin walled. Whereas bile ductule is lined by simple cuboidal epithelium. This is how you need to write about three structures, right? What are they? Portal venule, then hepatic arteriole, and then bile ductule. So how do they look, right? So this is how you can describe. If you can write the entire histology of the liver like this, nothing like that. This is all that is required, right? In liver, they can ask about two important structures, right? Two important histological structures or formation, which are called as, let's say, hepatic acinus, right? Hepatic acinus, and the other one is the portal lobule. So what is the difference between the two? For example, when we talk about portal lobule, this is a portal lobule, right? With the portal triad in the center. When we talk about the hepatic sinusoids, I would say, so when we talk about hepatic sinusoids, this is a hepatic acinus. So what is the difference between the two, the structure, and what is its functional importance? This is what we need to know, right? So this is what we should know in the histology of liver. Are we clear? Right. So once we have learned about how to describe the histology of the liver, let's check about how do we go about describing the histology of the pancreas. In histology of the pancreas, let's say we begin with pancreas is an exocrine gland. Okay, so it is an exocrine gland with an endocrine component, right? How do we describe the structure? So when you describe the structure, start with the structure of the exocrine part. Of course, the first thing you do is you draw the diagram, right? So start with exocrine part and then start with the endocrine part. So what do you write in exocrine part? Talk about the pancreatic acini and then pancreatic duct system, right? This is how you should mention it. So in pancreatic acini, one of the important keyword the examiner actually looks for is the centroacinar cells. So remember to highlight this. Highlight centroacinar cells and then talk about what are these and how these actually help in differentiating between pancreas and parotid, right? Then when you talk about duct system, start with the intercalated duct, right? The intercalated duct, which leads to intralobular duct, which leads to interlobular duct, which further leads to the main pancreatic duct. How the lining epithelium of these ducts differ. This is what you need to describe in the pancreatic duct system. In the endocrine part, it is pretty simple. We need to describe about the different types of cells. Alpha, then we have beta, then we have the gamma, and then we have the delta. So for each cell, morphology, how they look, and then what is their function. So imagine if you can write like this, okay? The examiner will not be able to deduct any marks, right? So this is why you should focus on structuring or presenting your histology discussion points, right? Once you do this, this will become the foundation for your histology practical. This is why I keep saying, don't think that histology is for 5 marks or 8 marks in paper 1, 5 marks or 8 marks in paper 2. Think of your think of your practical exam where you have the entire histology which can fetch you 13 marks, right? So importance of histology is not just in writing the theory exam, but also in once you do this, you can focus on your practical exam as well, right? Are we clear? So that is why histology of pancreas is important. Done? So in the topic of systemic histology, these are the topics, if I were to be a student, I would be well prepared for, right? Are we clear? So this is regarding the systemic histology. Now, one more high-yielding topic from the entire anatomy is genetics. And when we start the class on, let's say, Thursday, we will focus our discussion on the important questions that can come from genetics and how to answer these questions from genetics, right? So this is what I had to share in histology. If there are any questions, I'm happy to take them and answer. Right. So I guess there are no questions from the group. Thank you again for joining. We will join again on Thursday and we will discuss some of the important questions that can come from the topic of genetics, right? Till then, bye. Thank you for joining the session. Prepare well and all the best for your exams.